present yourself?
My name is Gopal Narasimhan. I'm a physician in gastroenterology.
And the name of your patient?
The name of my patient is Caridad Ortiz, and she was born in 1976, right, Caridad?
Yes. I'm behind the camera.
Did she sign the HIPAA?
She did sign the HIPAA, yes.
Caridad Ortiz, are you authorized the
Yeah,
doctor?
I authorize the doctor for the interview.
Let me finish the question here. What is IBS?
So IBS is the short name is IBS, the long name is irritable bowel syndrome. And IBS is comprised of three separate problems. And that's why it's called a syndrome. The first is change in bowel habits. So people go from constipation to diarrhea. Some people have more constipation, some people have more diarrhea. The second thing is abdominal pain. And the third thing is a decrease in your activities of daily living or an interference in your life. And so with the combination of all three, a lot of people have decreased activities that they're able to get involved in and have to change their lifestyles in terms of stress and what they eat. So it's a very difficult disease to treat. But luckily we do have some great treatments and some great options, some new medications, and we have good recommendations as to lifestyle changes.
How IBS affect the body?
IBS can do a couple of things. One thing in about 30% of people is that they have diarrhea. So the intestine speeds up and people have a debilitating diarrhea where they have to go to the bathroom multiple times a day. In other people, they have constipation, so their intestine slows down. It does the opposite thing, and both of these mechanisms are dependent on serotonin levels in the brain. So we have a neurotransmitter in the brain which controls digestion. And when that level of the neurotransmitter changes in the abdomen, and that can be a change because of stress, or it can be a change because of diet or some other physiological change, that serotonin level goes up or down, and people experience a change in the way they go to the bathroom and also very bad cramping abdominal pain.
So IBS affect daily activity then?
Absolutely, yeah. So IBS affects daily activities in most people, and people learn how to deal with the symptoms of pain, and they plan around their bowel habits. So some people have to get off the subway or have to figure out when, people with bad diarrhea, when they can take their medications because they know that they're going to go to the bathroom with constipation. So that's some of the side effects of the new medications, is having a little more diarrhea. But, people learn to deal with it and change their dietary habits in order to feel better. And that's our goal, is to have everyone feel much better.
So IBS, people that have IBS, that means that they're going to have it for the rest of their life?
Not necessarily. The intestine changes with age. So sometimes people's intestines speed up, sometimes it slows down. But in other people, as they get older, the symptoms get better. Someone's cell phone. It sounds like a Christmas.
Sorry.
That's all right. So not necessarily for the rest of your life, and people learn how to deal with it or treat it with either medications or with diet and exercise, and they can get much better over time.
I have a question.
Yes.
I want to know the importance of having a good communication with the doctor. How could that actually help with IBS?
Yeah, that's a really good question. Good communication is extremely important in this problem because it is a change in the way people feel, right? It's a change in their bowel habits, and also it requires lifestyle modification. Without accurate information, it's hard to make good recommendations, and prescriptions and medications can have the opposite effect of what we intend. So it's important to get a good history, a good physical examination, and to have an ongoing communication with an ongoing avenue of communication with the patients. So without it, it's going to be very difficult for someone to get better.
I have another question. If IBS is something that you just made up in your mind, or it's
Oh,
actually
no.
it's a physical condition?
It is a very, very physical condition, and it's something that we're learning more and more about. You know, IBS is probably the most studied gastrointestinal disease there is because it affects so many people in the United States and around the world. We have new medications. The FDA recognizes IBS as any other conditions like cancer or Crohn's disease, and we have medications targeted towards IBS. So we're not only is it a real condition, but it's a condition that there are new targeted therapies for.
Thank you.
No.
Thank you very much,
That's
Dr.
it. All
Gopal.
right, no problem.
Thank you.